Hi guys, I'm back with another important topic to be discussed. That is National Immunization Schedule. Right. So this National Immunization Schedule is very important, not only with respect to the practical, not only with respect to the that is NEET PG or any MCQs. సో మన ఇంట్లో కూడా కొంతమందికి లైక్ ఇప్పుడే న్యూ బార్న్ పిల్లలు ఉంటే దే విల్ కమ్ అండ్ ఆస్క్ యూ రైట్. సో వీళ్ళకి ఏ వ్యాక్సిన్ వేపియాలి అనేది అడుగుతూ ఉంటారు. సో మనకి దాని గురించి ఒక కంప్లీట్ ఐడియా ఇవ్వడానికే ఈ వీడియో చేశాను. సో వీ నీడ్ టు నో అబౌట్ ద నేషనల్ ఇమ్యునైజేషన్ షెడ్యూల్. It is helpful for you with respect to microbiology and also SPM and also pediatric posting. So in second year when you are going to postings, in pediatric postings, they will definitely ask you to know about the national immunization schedule. So I make it as much clear as possible for you. So let's learn about it. So this national immunization schedule is 2020 for infants and also for pregnant and also for children. So let's start it with the pregnant women. So for pregnant women, as you may be going for the OBG postings in second year, they will be letting you know that in the first trimester itself, you should give the tetanus toxoid. So the tetanus toxoid should be given in the early pregnancy, and we have to give the booster dose if received the 2 tetanus toxoids in a year in a pregnancy within the last 3 years, right? So this is what you have to know about the tetanus toxoid, and it is given in the intramuscular route and also it is given in the upper arm itself, right? So this is the tetanus toxoid 2 doses as well as the booster dose that you have to give with respect to the pregnant women. Now let's go to the infants or for the birth, that is for the infants, right? So for the infants, we will divide with respect to the time span, right? At the time of birth, at 6th, 10th and 14th weeks, at 9 months and 16 to 24 months and 5 to 6 years. So like that we will divide. So let's start it, and we have the BCG vaccine. We have for at the time of birth 3 vaccines here. So these 3 vaccines we can easily understand by a mnemonic that we have is boy had OP poisoning. So since you all are in second year, you are very much familiar with the OP poisoning that we will get in the pharmacology. So I have dealt this mnemonic. So B stands for BCG vaccine, H stands for hepatitis B birth dose, and OP stands for oral polio vaccine, that is 0 dose that we will give. So this is what I have seen. And BCG vaccine in pharmacology, you will know about the routes of drug administration. In that, the systemic route, we have this intramuscular, intravenous, subcutaneous as well as intradermal. So the BCG vaccine is given intradermal. It's the only vaccine which is given intradermal here, you can see. And also this IPV vaccine is also given intradermal. That's okay. So this BCG vaccine is for tuberculosis. Since we are living in India is endemic for tuberculosis. So at the time of birth, definitely we'll go with this BCG vaccine. And we have hepatitis B and oral polio vaccine 0 dose. So these are the vaccines which we are giving at the time of birth, right? So then we will move on to the 6th, 10th and 14 weeks. So these 3 time span will give following vaccines. So we have oral polio vaccine, first, second and third dose, and we have pentavalent vaccine. Then we have PCV vaccine, we have rotavirus vaccine, and we have IPV vaccine. But IPV vaccine will give only 6 and 14 weeks, right? We will not give at the 10th week, right? We only give at the 6th and 10th, 14th week, right? We skip the 10th week, right? So we have this 5 vaccines which we will give with respect to 6th, 10th and 14th week. So for this we have oral polio vaccine that is included in the 0 dose, that is also included here. Pentavalent vaccine is added, and PCV 3 doses, rotavirus vaccine and IPV vaccine. So for this, which we have is we have this oral polio vaccines and pentavalent vaccine, PCV, IPV and rotavirus. For this I have a mnemonic that is price of a vaccine. So this is the price of vaccine is very high nowadays in our India. So just a way to remember, it's not really, but this here you have P stands for pentavalent vaccine, and R stands for rotavirus, I stands for IPV, which is given only at the 6th and 14th weeks but not at the 10th week. And O stands for oral polio vaccine. That is first, second, and third doses. So this is what we'll see with respect to this 6th, 10th, and 14th weeks. Now let's move ahead to the 9th month. So after 9 months completion and up to 12 months, we can give these vaccines. So what is the mnemonic to remember them? We have a favorite and very famous dancer, that is Michael Jackson. So you can remember by his name, that is MJ Vibe. That is Michael Jackson Vibe. So M stands for measles, rubella, which is given in the subcutaneous route, and J stands for Japanese encephalitis, which is also given in the subcutaneous route itself. And we have vitamin A. Vibe stands for vitamin A, and this vitamin A is given orally. So this vitamin A is given orally, that you need to remember. And for children, so these all are for infants. So for infants, we have at the time of birth, boy had OP poisoning, BCG vaccine, hepatitis B vaccine, and also we have oral polio vaccine 0.8 dose. And for 6th, 10th, and 14 weeks, we have price of vaccine, right? So that's the mnemonic. P for pentavalent vaccine, R for rotavirus, I for IPV, O for oral polio vaccine, first, second, and third doses. And at the time of 9 months completion up to 12 months, that is up to 1 year, you can give we have a mnemonic, that is MJ Vibe, that is Michael Jackson Vibe. We have measles, rubella, and we have Japanese encephalitis, and we have vitamin A, which is given orally. Now let us go and discuss about the children. For children, these are somewhat older, right? So we have a mnemonic that my old dog just vomits. That's all. I have an old dog that just vomits. So this is a way to remember, or mnemonic to remember. Here M stands for measles, rubella, second dose, and O stands for oral polio vaccine booster, and dog, D stands for DPT, again booster dose 1, and J stands for Japanese encephalitis second dose, and vomits, V stands for vitamin A, that is second dose to 9th month. That is we have a first dose which we have given at the 9th month, and now we will go to give second dose. So how they are given? DPT, it is given intramuscularly, and we have MR, that is measles, rubella, again subcutaneous, and we have OPV, oral polio vaccine, in name itself it is given orally. We have Japanese encephalitis, subcutaneous, and we have vitamin A, again oral. So here this completes the entire national immunization schedule. But now I want to discuss some questions regarding it. So let's discuss them. So this is the question that you need to know, that is which of the following vaccines are not given at the time of birth? So can you tell me which of the following vaccines are not given at the time of birth? So definitely we have a mnemonic to remember, that is boy had OP poisoning, right? So in this, B stands for BCG. So definitely BCG is given intradermally, so it is given at the time of birth. So actually it is given at the time of birth. And also H stands for hepatitis B vaccine. So hepatitis B vaccine is also given at the time of birth. O stands for oral polio vaccine. Hepatitis B vaccine is given intramuscularly. Oral polio vaccine is given orally. So oral polio vaccine also. So what is not given at the time of birth is DPT. So we will not give DPT at the time of birth, right? So this is what one more question we have, that is what all vaccines does pentavalent vaccine includes? So pentavalent, as the name indicate, it includes 5 vaccines, right? So the 5 vaccines which are included are, so we have, first thing is we have hepatitis B vaccine, and we have DPT. So what does DPT stands for? DPT stands for diphtheria. Actually P stands for pertussis, but it is actually now it is acellular pertussis. It's not just pertussis, it's acellular pertussis. T stands for tetanus again. Then we have Hib vaccine, which is included in the pentavalent vaccine. What is Hib? It is Haemophilus influenza type B vaccine which is included. So we have hepatitis B, DPT, Haemophilus influenza type B vaccines, but we doesn't have this BCG vaccine which is given at the time of birth. So this DPT vaccine is BCG vaccine is not included in the pentavalent vaccine. So this is the correct answer. So these are some of the MCQs, and this is the discussion about the National Immunization Schedule. Thank you so much, and stay tuned for more such content.